Well, good morning and welcome. This is my second CXO forum. I attended my first one this summer, and I found it really to be an interesting type of a session, and really one in which I gained a lot of value, and why I'm committed to continuing. Being from healthcare, I'm probably the least qualified to be the chair of the big data group, since we're probably the industry that's the furthest behind. But I'm certainly interested in learning from all the others here today that are speaking, and we'll look forward to the action items that we identify coming out of the day. I've been with Sharp Healthcare and in San Diego for just a little over 10 months. I'm a Midwest boy by background and lived in North Dakota for a number of years, and then most recently was in Omaha, Nebraska. So I'm still getting adjusted to the wonderful weather and the wonderful things in San Diego and Southern California. Mostly getting adjusted to how people can't drive in the rain. Luckily, it doesn't occur that often. But so I left very early this morning because I wasn't sure how much rain it was going to be and how the traffic was going to be. So very pleased to get here in just a little over an hour. So I want to talk about just 2 or 3 things in my little time here. Once I want to talk a little bit about what's going on in healthcare around data analytics and big data. And then specifically, I'll talk a little bit about what Sharp's doing. And then some of the challenges and opportunities that I see, at least from my perspective and from the healthcare world going forward. And then we'll look forward to other people's discussions and then our breakout. So first of all, as I said, healthcare is late to the game as it relates to analytics and especially the advent of building data warehouses and that. Most of healthcare organizations are really just getting started. There are a few notable exceptions, people like Cleveland Clinic, Ohio State, Intermountain Healthcare, UPMC in Pittsburgh. But for the most of us, it's really a new venture. And some of those organizations that I mentioned before that started out on their own and built their own data warehouses, and they've actually commercialized their product. So out in the market, you can actually start with a product that was first developed at Intermountain Healthcare, Ohio State, Cleveland Clinic, and UPMC. And so that's really helping the rest of the industry kind of get launched into the whole role of data and analytics. And some of the main reasons why we've been late to the market is because our core business had not really been automated. So we always had a lot of automation in the supply chain, the finance, the human resources, accounts payable. So those that were building analytics at all were doing it really around financial data and kind of retrospective reporting. But in the last 5 years, with the heavy emphasis on the Affordable Care Act and the High Tech Act that helped fund the implementation of electronic medical records in healthcare, we began to really get the data collected and digitized that really would help us do analytics. So that's one of the main reasons why healthcare has been so slow really to get into this space. But even though they're slow, as we get into this, big data is becoming increasingly important. And that's really driven around 3 reasons, and maybe similar reasons in other industries. But first and foremost is the fact that a lot of our data, even though we've digitized, is still fairly unstructured. Some of the key data like physician progress notes and information that we're collecting about the description of a person's disease or what they're treating, even despite the best efforts of people trying to make sure we digitize that and did drop downs, in general what the industry has gone to is an adoption of more like digital voice recognition. And so we've got a lot of textual data that's transmitted or translated into digital data that's really not codified very well. So we have a big need to look at how can we really mine the unstructured data that we have. Secondly, there's an explosion of data sources, first driven really by the development and the sequencing of the human genome, but the genomics side of the equation is the amount of data that's collected in that scenario is really significant. And we see more and more of that going to be incorporated into the way in which we look at the treatment of individuals. And also because we have a rapidly changing business model. So we need to be more dynamic in our ability to analyze data, to look at where we're going. And then I mentioned the other data set that's becoming increasingly important is the monitoring data, the Internet of Things, everything that we're beginning to look at as we move into an industry that tries to manage health instead of manage sicknesses. How can we continually monitor individuals and in their health and when they're outside of our care settings. So we have a lot of data that's beginning to be collected that's outside of our normal applications, and we really need to deal with that. So even though we're late to the industry and we're currently building our enterprise data warehouses, we're also having organizations to have to look at their strategy around big data. So talk a little bit about what Sharp is doing. Sharp is actually one of those few organizations that got into data and analytics early, and that was really driven around managed care and the kinds of contracts that Sharp was working with as far as their assumption of risk. And that's very unique. Managed care in healthcare started in the 90s and then kind of faded away in the rest of the country. But in Southern California, it stayed as a way in which to provide care. And essentially what that means is that Sharp takes on full risk. So we get a capitated or a per member payment cost of that care. If it's more than we got, then we lose money on it if we manage it. So in those programs, there was a lot of need to really analyze how we were performing, and also a lot of need in some of our other programs to report key quality indicators, key metrics. So because that's not readily available, Sharp got into the business of starting an enterprise data warehouse, bringing data in from claims data, from as we were digitizing the record, from other sources to really be able to begin to analyze that. But it's been a very kind of siloed process, and so we've supported our foundation medical group, we've supported our health plan, we've supported our community medical group, and then kind of the hospitals, but we've done that kind of individually. And what happened is in the last 2 to 3 years, as Sharp got into some different programs or began to look at what we call enterprise analytics, we began to run into some real issues around the definitions of data and the data governance aspects, because it was okay in your point solution as long as you defined it a way you knew and you understood. But then even simple, what you would think were simple things like uniquely identifying a physician across all of our different organizations was difficult to do. And as we tried to implement enterprise solutions that looked at data across all of our different organizations, we ran into some real issues with governance. And so when I first got to Sharp, one of the first things they said is you need to fix the data governance problems. And I said, well, you know, I'm sure I'm not going to be able to fix it, but we will definitely address that. So we started with stepping back and taking an enterprise-wide view of data and getting our executive team to really understand that data is really an organizational and an enterprise asset. And we really need to look at it from that perspective, and we really need to set our strategy and our vision for data and analytics as much at an enterprise level as we did at that, you know, base operational levels. So we created a position of Vice President of Enterprise Analytics. We reformatted and restructured our functioning committee that oversaw data and analytics. We call them product committees within Sharp, to create an enterprise analytics committee that had responsibility not only for helping prioritize and manage the demand that was moving up from the individual units, but also to establish a strategy and drive the enterprise-wide needs in conjunction with the executive team. We also then formed a new data governance committee and formalized the role of data governance. And it was our belief, at least my belief, that if we didn't get the enterprise level executives committed to the value of data as an asset, we would never get them to support the changes and the resources it was going to take in their individual departments to manage the data and to make changes in the way they collect and process data and define the data on an enterprise level, unless they really saw it as a value and an asset across the organization. So we're very new into that, but what's emerging is this area of what I'd call unstructured data analysis, or the incorporation of other things into the non-traditional enterprise data warehouses. It just doesn't fit in there very well. So we're really just beginning to look at how we're going to deal with that set of data. There are a lot of natural language processors that are out there. There are a lot of tools that people are saying we could solve this solution, and so we really need to get a strategy around that. And that really gets into kind of, as I look at this, what do I see as kind of the key challenges and opportunities as we go forward. The first thing is that there's just an explosion of technology and tools that's emerging in the space. It's like every week we have a vendor come forward and say, can you look at this tool? We have this revolutionary approach to accessing or to storing or to analyzing data that can allow you to go after unstructured data in a way you've never done before, or it's so much faster than things you've ever done before. And then we also have, as I said, point solutions in healthcare, which are saying, we've solved this problem at this organization. Now we can come in and analyze your physician notes and help you solve that problem. So, and then just the underlying technologies are evolving rapidly. So we have a lot of work to do to try to understand that. And I think that's an area where we can leverage what other people have done and learn from what other organizations, other industries have done to look at this whole challenge. The second thing is that we're seeing a lot of these solutions come in as software as a service, or what I'd call operational budget types of programs. So it's easier for them to get into the organization without us even knowing about it. So one of the things we've challenged our enterprise analytics group about to do and trying to enforce throughout the organization is that any tool that comes in that's really focused on analytics has to be vetted through that group to say, is it something we already have? Is it something we should be developing out of our data warehouse? Is it an organizational priority? And then how does it fit in, and how are we going to feed it? Because the assumption is you just plug these systems in and they work and they look at the structured data and the unstructured data, but we really have to feed it. So we need, they come in, they can come in, you know, kind of back door for us. And then it doesn't negate the data governance issues. In fact, it probably even exaggerates the need to get our hands on top of that. So we're looking to try and take a somewhat structured but responsive approach to our entry into the big data space. So we want to start from an organizational perspective. What are the bigger organizational needs as we look at this? You know, kind of, I would say, more generalize it instead of looking at very specific or unique needs. Say, we're going to have needs to analyze this kind of data. We're going to have needs to bring this kind of data in and do these kinds of things and be responsive. And so if we can define it more at an enterprise level and get some general definitions of the types of functions we're going to need to be able to do, then that's a start. And then we need some help, and we'll work with others to go out there and look at what's out there and what tools are available. And then our thought is maybe to pick one of those key challenges and try to see how we solve that, but we solve that in a way in which it can be built on to solve other organizational needs instead of just being a point solution. So, you know, we don't know what tools we're going to bring in. We really, you know, I'm really excited to hear what other people are doing with Hadoop and things like that. We've been talking to some other healthcare organizations that are a little further ahead of us, even here in Southern California. Sutter, St. Joe's Healthcare, and others have started to get into this space, so Kaiser, so we're really trying to learn from that. And then try to make it in a way in which, you know, we can solve organizational needs, but we can build off of that and then be able to solve more needs. The same way we're trying to do it with our data management. We've decided to implement a tool to solve that physician or provider definition program problem, so we have a kind of a, you know, an enterprise-wide master dictionary for provider, but do it in a way in which we can build off of that and solve some other problems rather than just bringing in a point solution for one thing at a time. So I'm really interested to hear what others are doing, what some of the other thoughts and challenges are in this space, and then getting into our breakout session. So as a group, we can identify a couple of top needs that we may be able to work on collectively over the years. So thank you.